I recently attended a conference sponsored by the New York Times at UCSF entitled Health for Tomorrow, Medicine, Research, Policy and Wellness. And I'd like to share with you today some of the discussions that occurred at that conference. In attendance and presenting on healthcare issues were some of the brightest minds in the world, including a Nobel Prize winner in medicine. Also presenting was Mark Pauly, Professor of Healthcare Management at Wharton. And he said, spending increases in healthcare are not likely to level out very soon. He said families are focused on their out-of-pocket cost. You better believe it. He also went on to say, from an economic point of view, that market forces would keep prices down. Well, we simply know that hasn't been the case. There was a great session on individualized medicine, and Eric Topol from the Scripps Research Institute said, the difference between cost and charges are profound. He said we have the best technology in the world. He said we have the best healthcare in the world. But then went on to say, why are we doing mammography every year when it does more profound harm than good? He said they are still doing PSA tests every year, which also cause profound harm. And he went on to say that no physicians in this country inform their patients of the millisievert radiation dosage from CT scans. He said of 1,000 mammograms performed, 600 women will be harmed, and only 5 will benefit over a 10-year period. Elizabeth Rosenthal from the New York Times said we often default to the most expensive way of doing things or the most profitable. And she said we have to stop engineering diseases in people. This was in reference to the low testosterone ads that are flying around TV, where low T is dangerous stuff. Toby Crossgrove was an interesting presenter, President and CEO of the Cleveland Clinics. He heads a $6 billion healthcare system, multiple hospitals, employing some 43,000 people. He said healthcare is now 18% of the United States GDP. That's $1.06. He said healthcare used to be from business to business. Now it's from business to consumer. And of course he was making reference to the direct-to-consumer advertising of prescription medications. Toby said there's a lot of hospital construction. He said the housing boom is over. And he said the Cleveland Clinic is the biggest employer in Cleveland. He went on to say there's no transparency on cost. But he thought that lab tests will be increasingly done at places like Walgreens or Walmart. There was a great section on big data in medicine, predictive analytics, and they looked at patients with multiple diseases and comorbidities. And they thought that the goal for the future of healthcare was to, quote, increase healthcare outcomes, and then secondly, to control cost. Well, that's aspirational, but it's certainly failing on both counts. And he quoted a Stanford researcher who explored numerous medical journal articles over a number of decades and concluded that, quote, most medical research was wrong. He discussed the issue of Prozac and how the cost per person was higher per user by some $500 a year. It had less side effects than its predecessor drug and had less hospital visits. But from our perspective, when we think about that, are we asking the right questions? Maybe we shouldn't have used Prozac at all. Was there a non-drug replacement? So in this big data collection, looking at large data sets of people with multiple health issues, the term population analytics was used. However, the problem here is that it's an inductive model. Something, again, we've known in chiropractic for many years. If you have 1,000 people in your study and they have certain conditions and profiles, then you assume that to the 1,001th person that turns up, that treatment or outcome will be the same for them. And as Jeffrey Rice said, when referring to RCTs, he said the problem with RCTs is they're great for what they study, but they're very narrow. When speakers decried the patient-centred view, we should have a patient-centred view in healthcare. Well, again, that was noble. Again, I think it's the way of the future. However, it wasn't a holistic view of patient care. Dr. Martin Cohn was the Chief Medical Scientist at Big Health. He's an eminent physician. And when asked the question, Martin, if you had your time all over again at medical school, what would you wish you had learned? And his answer was astounding. He said, if I had my time again, I wish I would have spent more time on critical thinking and less time on memorization. And in chiropractic, we know philosophy is an essential element. It is also an essential feature of how we practice, teach, and enjoy our lives here at Life West. The concept in medicine of algorithms, of course, are deterministic. The CEO of Kaiser Permanente, Bernard Tyson, made an interesting observation, and I quote, he said, "The variation in healthcare is unbelievable." William Hasseltine, the biologist, entrepreneur and philanthropist, said, "I'm very concerned about the healthcare industry." He said, "I used to think the best thing we could do is to increase our knowledge base." And he went on to say, there is limited access to healthcare in the US. He said, we pay twice as much as the rest of the world, and of course, we get lousy results. He said, we rank number 40 in the world in healthcare outcomes. And he said, quote, "The failure of the pharmaceutical industry as a business model is profound." He said, in a monopoly market, you increase your price or you get a tax break. He said, there needs to be a restructure of that whole model. And he said, drug companies are a sales and marketing company. And he said, you can't really do R&D and sales marketing from the same company. But what was fascinating was his comment, how we look at patients in this country is a scandal. And went on to say you can't take healthcare and try and solve the problems of healthcare costs. He then went on to say that the healthcare industry has so much power as it is the driver of jobs growth. And his conclusion was that there's almost an incentive to keep people sick. So one of the conclusions I had was, here were the brightest minds in this country of the best technology available. We get poor results, and we have a failed model. And as these people sat around looking at solutions, it was looking at a funding model that might be different. It was trying to look at personalised medicine, possibly using genetics as a predisposition to health outcomes. They really forgot some fundamental ideas about health and well-being, which is how we look at the body in healthcare from a chiropractic perspective. It's how we look at life itself. And one of the most exciting things I walked away with from this conference, and I met some great people, was that our paradigm on health, our paradigm on chiropractic, and the way we look at life is kind of on the right track. So if you're out there and practicing chiropractic, or you're out there studying chiropractic and you're scratching your head and saying, are we on the right track? An important thing to reflect on is that in medicine, outside of critical or emergency care, they're simply on the wrong track and they're looking for an answer. And if we can step up what we're doing, if we can do it at a higher level, if we can increase our focus and our outcome in terms of chiropractic research, then we can really have a lot more to offer the world. To do that, of course, we need more chiropractors. We need stronger chiropractic institutions, and at Life West, that's what we're committed to do. Thank you.